Let's be brutally honest about the VA. It's a government-run healthcare monopoly that fails veterans every single day. The average wait time for a new patient appointment is 37 days. Veterans are dying while waiting for care they earned through their service. VA hospitals rank among the worst in the nation for patient satisfaction, infection rates, and treatment outcomes. This isn't because VA doctors and nurses don't care. Many are dedicated professionals. It's because government bureaucracy inevitably produces inefficiency, UN accountability, and mediocrity. When there's no competition, when a system faces no consequences for failure, it doesn't improve. We spend $300 billion annually on veterans' care, yet 22 veterans die by suicide every day. That's not a funding problem, it's a systemic failure problem. Here's the solution. Give veterans full healthcare choice. Let them use their VA benefits at any healthcare provider, private hospitals, private doctors, private mental health clinics. Competition will improve both VA facilities and give veterans immediate access to quality care without unconscionable wait times. The VA can remain an option for those who prefer it, but no veteran should be trapped in a failing system. Healthcare choice works for Medicare beneficiaries. It'll work for veterans. We owe them the best care available, not the best care government bureaucrats can deliver. Let veterans choose. Let providers compete, and watch outcomes improve dramatically.
Tom, your solution sounds simple, but it would destroy the one thing that actually works about veterans' care: specialized, integrated treatment for service-related conditions. VA doctors understand PTSD, traumatic brain injury, burn pit exposure, military sexual trauma in ways civilian providers simply don't. They treat thousands of these cases, developing expertise no private practice could match. When you fragment care across private providers, you lose care coordination, medical records don't transfer properly, and veterans end up telling their trauma stories repeatedly to different providers who don't understand military culture. The suicide crisis you mentioned isn't about wait times. It's about inadequate mental health funding, insufficient suicide prevention programs, and veterans falling through cracks when care isn't coordinated. Privatization makes that worse, not better. Yes, the VA has serious problems, but the answer isn't abandoning a specialized system. It's fixing and funding it properly. We need to hire more mental health providers, reduce patient loads, modernize facilities, and implement proven suicide prevention programs. The Mission Act already allows private care when VA can't provide timely service, so veterans aren't trapped. What they need is a VA with adequate resources, not wholesale privatization that profits insurance companies while fracturing care. Countries with integrated veteran systems like Canada and Australia have better outcomes than our fragmented approach. Let's learn from what works, not repeat the same privatization failures we've seen throughout healthcare.
Lily, you make a crucial point. I need to acknowledge, VA providers do have specialized expertise in service-related conditions that civilian doctors often lack. And you're right that fragmented care can lose important continuity and context. But here's where you're wrong. The current system isn't working despite that expertise. Veterans are still waiting, still suffering, still dying. So let's find middle ground. Keep the VA system for those specialized services where it genuinely excels: PTSD treatment, prosthetics, traumatic brain injury, military sexual trauma counseling. These require providers who understand military service and see enough cases to develop deep expertise. Invest heavily in these core competencies. Hire more mental health providers. Reduce caseloads. Modernize facilities for specialized care. But for routine care, annual checkups, minor injuries, chronic disease management, let veterans choose private providers if they prefer. This hybrid model gives veterans immediate access for routine needs while preserving specialized VA expertise for complex service-related conditions. Add real accountability. If VA facilities consistently fail quality or timeliness standards, leadership gets replaced. Create transparent report cards on every VA facility showing wait times, patient satisfaction, treatment outcomes. Veterans deserve to know which facilities perform well. And implement your proven suicide prevention programs, but add immediate crisis access. Any veteran in mental health crisis gets seen same day, either at VA or pre-approved civilian facility. No exceptions, no paperwork barriers. Make mental health the absolute top priority.
Tom, now you're thinking like someone who actually wants to solve the problem, rather than score ideological points. Your hybrid model addresses my concerns about preserving specialized expertise while acknowledging that veterans need better access. I can absolutely work with strengthened VA core competencies plus routine care choice. And thank God you're willing to prioritize mental health with same-day crisis access. That alone would save lives. Let me build on this. Expand VA's community-based care program, where VA partners with local providers, trains them in military culture and service-related conditions, then credentials them as part of the VA network. Veterans in rural areas or underserved urban neighborhoods can access care locally instead of driving hours to VA facilities. VA maintains oversight and quality standards, providers get specialized training, veterans get convenient access. This preserves care coordination while expanding access. For suicide prevention, implement comprehensive screening at every VA contact, primary care, dental, pharmacy pickup, everything. Train all staff in crisis recognition. Deploy veteran peer support specialists, veterans who've successfully managed their own mental health challenges and are trained to support others. Research shows peer support is incredibly effective, and it employs veterans in meaningful work helping other veterans. Create regional crisis response teams that deploy within hours when a veteran shows suicide risk factors. And critically, automatic mental health follow-up for any veteran who has been in crisis. No falling through cracks.
That rural veteran story is exactly why one-size-fits-all fails. Your community-based care with VA training and oversight brilliantly solves the geographic access problem while maintaining quality standards. And rural areas could hugely benefit from telemedicine infrastructure. Veterans consult with VA specialists remotely for routine care, with local civilian providers handling in-person needs under VA coordination. But let's push this further. Deploy mobile VA clinics to underserved areas, converted RVs staffed with VA providers traveling circuit routes to bring care directly to rural and remote veterans. Costs far less than building new facilities and reaches veterans where they are. Some veterans are too proud to seek help or too isolated to access it. We bring it to them. Your Veteran Peer Support Specialist program is outstanding. Let's fund it robustly and make it a permanent, professionalized career track within VA. Veterans Helping Veterans reduces stigma, increases trust, and provides meaningful employment. Combine peer support with your universal screening protocol. Every touchpoint is an opportunity to identify veterans at risk and connect them to immediate help. And here's something we haven't discussed but is critical: family support. Military families serve too. Spouses, children, parents who support service members and veterans. They deal with secondary trauma, financial strain, relationship stress. Provide mental health services to immediate family members of veterans, especially those caring for severely wounded warriors. Caregiver burnout is real and destroys families. Support the whole veteran ecosystem, not just the veteran in isolation.
Tom, I'm genuinely moved that you're recognizing family support as essential. This is often overlooked in veterans policy discussions. Military families do serve alongside their service members, sacrificing careers, stability, and their own well-being. Your point about caregiver burnout is critical, especially for families caring for severely wounded warriors who need around-the-clock support. Let me expand on family support comprehensively. Provide mental health counseling for military spouses dealing with deployment stress, repeated relocations, and the anxiety of having a loved one in danger. Include children in support services. Military kids face unique challenges moving frequently, dealing with parental deployment, and sometimes losing a parent to combat or suicide. School liaisons help kids transition between school systems without falling behind academically. Employment support for military spouses is crucial. They sacrifice their careers for frequent moves and deployments, leading to resume gaps and lost earning potential. Connect spouses with remote work opportunities, portable careers, and employers committed to hiring military families. And for families of wounded warriors, provide respite care so caregivers can have breaks without leaving their loved one without support. Financial counseling, since catastrophic injuries create enormous expenses, and peer support groups where caregivers connect with others facing similar challenges. This comprehensive family support strengthens the entire military ecosystem. When families are supported, service members can focus on their duties knowing their families are cared for, and veterans transition more successfully when they have strong family support systems. We've now built the foundation of truly comprehensive veterans care, from strengthened VA services to family support. Let's talk about how we actually implement this.
The VA benefits claims process is an absolute disgrace. Average processing time for disability claims is 157 days, over 5 months for benefits veterans already earned through their service. The appeals process can take years. Meanwhile, veterans struggle financially, can't access health care they need, and spiral into poverty or homelessness, waiting for benefits that are rightfully theirs. This isn't acceptable, and it's completely fixable with modern technology and basic accountability. First, create a fully digital claims system with intuitive interface. Think filing taxes online, not navigating 1990s government websites. Veterans upload medical records, service records, supporting documentation digitally. System auto-populates forms, flags missing information immediately, and provides clear checklist of requirements. No more paper, no more mailing documents that get lost, no more starting over because one form wasn't notarized correctly. Second, use artificial intelligence to review claims, cross-reference medical records with service history, and flag incomplete applications before they enter the system. This eliminates months of back and forth. AI generates preliminary ratings which human reviewers validate, combines efficiency with human oversight. Third, and this is crucial, implement mandatory processing timelines with accountability. Initial decisions within 60 days, appeals within 90 days. If VA misses deadlines, claim is automatically escalated, and veteran receives interim benefits. Track performance by facility and by individual claims processors. Consistently poor performers get remedial training or reassignment. This is basic performance management that every private company does but government refuses to implement.
Tom, I'm actually thrilled you're acknowledging the claims processing disaster and willing to fund technological modernization. Too often, Republicans complain about government inefficiency, but won't fund the improvements that would fix it. Your digital system, AI-assisted review, and mandatory timelines would transform the process. But let's talk about why the backlog exists in the first place. VA claims processors are overwhelmed. Caseloads averaging 85 to 100 claims per processor, working with the outdated systems you described. They're not incompetent, they're under-resourced. We need to hire more claims processors immediately while implementing your technological solutions. Can't just automate our way out of decades of backlog. And many claims get denied or delayed because veterans don't know how to properly document their conditions or connect them to service. Create veteran advocate positions, trained staff who help veterans prepare strong initial claims with proper documentation and medical evidence. This reduces denial rates and appeal volumes, unclogging the entire system, like having a tax accountant help with a complex return. You get it right the first time. Your AI review system is smart, but adds safeguards against bias. AI trained on historical decisions might perpetuate past discriminatory patterns, particularly around mental health claims, female veterans, or minorities. Require human review by veteran advocates before any denial, and veteran has right to appeal to Human Claims Board. Technology assists humans, doesn't replace human judgment on these critical decisions affecting veterans' lives.
Now let's talk about transition, the moment when active duty becomes veteran. Currently, we provide transition assistance program workshops that last a few days, teach basic resume skills, then send service members into civilian world unprepared. Suicide rates spike in the first year after separation. Employment rates drop. Mental health struggles emerge. We're failing at the exact moment veterans need support most. Here's comprehensive transition support. Extend TAP to 3 months before separation with mandatory participation, not optional. Include job placement assistance with partner companies committed to hiring veterans, financial planning for civilian life, mental health screening and support access, spouse employment assistance if applicable. Don't just teach resume writing. Connect veterans directly to jobs, provide interview coaching, facilitate networking with veteran employees at companies. Create certification programs translating military skills into civilian credentials. Military medic gets EMT certification. Logistics specialist gets supply chain credential. IT specialist gets cybersecurity certification. This makes military experience immediately valuable to civilian employers. And establish veteran mentorship networks, matching recently separated veterans with those who have successfully transitioned in similar career fields. Someone who's navigated that path can provide invaluable guidance and connection. Make these mentorships formal, supported through veterans organizations, not just hoping people connect on their own.
Tom, your expanded transition support with job placement, credential translation, and mentorship networks would address one of the most vulnerable periods in a service member's life. I especially appreciate your focus on that first year when suicide risk peaks. Let me add the mental health component. Mandatory mental health screening during transition process, with immediate connection to services if issues emerge. Not stigmatized or career-affecting since they're already separating, but preventative. Many mental health issues don't fully manifest until after separation, when military structure and purpose disappear. Catching them early prevents crisis. And recognize that transition affects entire families. Military spouses sacrifice careers for frequent moves, deployments, and military needs. When service member transitions, spouse needs employment support too. Provide job placement assistance, skills training, networking opportunities for military spouses. Kids transitioning from military schools and communities to civilian neighborhoods need support adjusting. Family mental health counseling should be included in transition services. Here's something else: housing assistance. Military families often live on base or in military housing. When they transition, they're suddenly navigating civilian housing markets, mortgages, security deposits, rental agreements, without military support systems. Provide housing counseling, connect with veteran-friendly landlords and lenders, assist with VA home loans. Homelessness prevention starts with housing security during transition. And for seriously wounded warriors transitioning, ensure seamless connection to long-term disability benefits, adaptive housing, caregiver support, and vocational rehabilitation without bureaucratic gaps.
That success story should be the norm, not the exception. Your family transition support and housing assistance are critical missing pieces. Veterans don't transition in isolation. Entire families navigate that shift. And you're absolutely right that serious mental health screening during transition could prevent countless crises. Here's how we make your engineer's success story common. Create substantial tax incentives for companies hiring and retaining veterans. Not token incentives, but meaningful reduction in payroll taxes for first 3 years of veteran employment. This makes veterans highly attractive hires, offsetting any perceived risk from employment gap or lack of civilian experience. Companies that develop strong veteran hiring and retention programs get public recognition, preferential status on government contracts, and additional incentives. Make it profitable to invest in veteran success. Require federal contractors to hit veteran employment targets. If you're making money from government contracts, you should employ those who served. Add performance tracking for all transition programs. Employment rates, earnings, retention, housing stability, mental health outcomes at 6 months, 1 year, 5 years post-separation. Programs that don't deliver measurable success get reformed or defunded. Programs that work get expanded and replicated. This data-driven approach ensures we're actually helping veterans succeed, not just checking boxes. and create veteran entrepreneurship programs. Many veterans have skills and drive to start businesses, but lack civilian networks and capital access. Provide small business training, connect with mentors, facilitate access to capital, offer preferential status in government contracting. Veteran-owned businesses create economic opportunity and employment for other veterans.
Tom and I have built something remarkable over the past 18 minutes, a comprehensive veterans care plan that addresses both Republican concerns about efficiency and choice and Democratic priorities of adequate investment in specialized care. Let me begin summarizing what we've agreed to. First, a hybrid healthcare model combining strengthened VA infrastructure for specialized service-related care with private sector choice for routine care and geographic access gaps. The VA excels at treating PTSD, traumatic brain injury, burn pit exposure, prosthetics, and other military-specific conditions that require providers who understand military service. We invest heavily in these core competencies while giving veterans choice for routine care. This preserves specialized expertise while ensuring immediate access. Second, immediate mental health crisis response with zero wait times. Any veteran in mental health crisis receives same-day care at VA or credentialed civilian facility. No exceptions, no paperwork barriers. Universal mental health screening at every VA touchpoint. Regional crisis response teams deploying within hours to at-risk veterans. Veteran peer support specialists embedded throughout the system. Comprehensive suicide prevention programs with automatic follow-up. We're ending the epidemic of 22 veteran suicides daily through proactive intervention. Third, comprehensive transition support starting 3 months before separation and continuing 1 year after. Extended transition assistance program with mandatory participation. Job placement assistance with partner employers committed to hiring veterans. Credential translation programs converting military skills into civilian certifications. Veteran mentorship networks. Mental health screening and immediate support access. Family employment and housing assistance. We're preventing homelessness, unemployment, and mental health crises through proactive support at veterans' most vulnerable moment. Fourth, modernize benefits claims processing with intuitive digital systems, AI-assisted review for efficiency, mandatory processing timelines with accountability, and veteran advocates helping prepare strong initial claims. Initial decisions within 60 days, appeals within 90 days, interim benefits if VA misses deadlines.
And I'll complete our 7-point plan. Fifth, expanded community-based care networks where VA partners with local providers, trains them in military culture and service-related conditions, then credentials them as part of the integrated VA system. Veterans in rural areas, like our Montana Rancher, access care locally with VA coordination maintaining quality standards. Mobile VA clinics bring services directly to remote areas, converted RVs staffed with VA providers traveling circuit routes. Robust telehealth infrastructure connects veterans to specialists regardless of location. This eliminates geographic barriers while preserving care coordination and VA expertise. Sixth, professional career tracks for veteran peer support specialists. Veterans who've successfully managed mental health challenges are trained and employed to support other veterans. Research shows peer support dramatically improves outcomes and reduces stigma around seeking help. This provides meaningful employment for veterans while delivering proven intervention. These positions are funded robustly, professionalized with clear career advancement, and embedded throughout VA healthcare and transition systems. Veterans Helping Veterans works. Seventh, comprehensive family support recognizing that military families serve alongside their service members. Mental health services for spouses and children dealing with deployment stress and military lifestyle challenges. Employment assistance for military spouses whose careers were sacrificed for frequent moves and military needs. Caregiver support programs for families caring for severely wounded warriors. Respite care, financial counseling, peer support networks. Housing assistance during transition from military to civilian life. Family counseling during deployment and reintegration periods. We support the entire veteran ecosystem because strong families enable veteran success. This plan will cost approximately $40 to $50 billion annually in additional federal investment. But as Lily said earlier, this is a sacred obligation, not discretionary spending. We ask these Americans to risk everything for our country. Providing excellent health care, timely benefits, and successful transitions is the absolute minimum we owe them.
What makes this plan transformative is that it's based on proven interventions, not political promises. Every component has been demonstrated to work. We're finally implementing them comprehensively and with adequate funding. Hybrid care models combining specialized expertise with choice work in other healthcare systems. Immediate mental health crisis access works in countries that properly fund it. Comprehensive transition support works when we invest in it adequately. Modernized claims processing works in the private sector and progressive federal agencies. Community-based care works where VA has piloted it. Peer support programs work everywhere they're properly implemented. Family support measurably improves veteran outcomes. Here's our phased implementation strategy. Phase 1. Immediate legislation establishing the comprehensive framework, funding allocations, and accountability standards. This can achieve bipartisan support because it addresses Republican concerns about efficiency and choice alongside Democratic priorities of investment and specialized care. Phase 2. Year 1. We modernize technology infrastructure for claims processing, hire additional mental health providers and claims processors to address backlogs, establish veteran advocate positions, and launch pilot community-based care networks in underserved areas. Phase 3. Years 2 through 3. Fully implement the hybrid care model nationwide. Expand transition support programs to all separating service members. Scale peer support specialist positions throughout VA system. Deploy mobile clinics to rural and remote areas. And establish comprehensive family support services at all VA facilities. Phase 4. Year 5. Comprehensive evaluation measuring outcomes against current baselines. Are wait times reduced? Suicide rates decreased? Veterans successfully employed and housed? Benefits processed within mandated timelines? Programs demonstrating success get expanded and replicated. Programs failing to deliver results get reformed or defunded. Include mandatory congressional review every 3 years, ensuring continued effectiveness and allowing mid-course corrections. This is evidence-based governance with real accountability.
The most important aspect of this plan is that it's guided by a fundamental truth. Veterans, care isn't a partisan issue, it's a moral imperative. These men and women volunteered to defend our country, deployed to war zones, sacrificed time with their families, risked, and sometimes gave life and limb for our safety and freedom. We don't get to debate whether we owe them excellent care. We absolutely do. The only question is whether we have the political courage to implement it. And make no mistake, this requires real courage, because special interests will fight it. Insurance companies want unrestricted privatization without quality standards or accountability. Some might resist accountability measures that threaten profit margins. Deficit hawks will complain about the $40 to $50 billion annual investment, despite it being a fraction of what we spend on defense procurement. But if we keep veterans at the center of every decision, base our choices on evidence rather than ideology, and hold all stakeholders accountable for measurable results, we can overcome any opposition. This plan achieves something remarkable. It gives both parties what they claim to value while compromising nowhere on quality or outcomes. Conservatives get choice, competition, efficiency, accountability, and elimination of bureaucratic waste. Progressives get specialized VA expertise, adequate investment, mental health as a priority, and protection against exploitation. But most importantly, veterans get what they earned through their service. Excellent health care when they need it, benefits processed without years-long bureaucratic nightmares, successful transitions into civilian life with comprehensive support, robust mental health services that prevent crisis, and the dignity and respect their sacrifice deserves. This isn't charity. This isn't political favor trading. This is fulfilling our sacred obligation to those who answered our nation's call to service.
Americans across the political spectrum revere military service and truly want to honor veterans, not with empty rhetoric on Memorial Day, but with real action that delivers real results. This conversation has proven that the divide on veterans' care isn't nearly as wide as politicians make it seem. We can have specialized VA expertise alongside private sector access. We can have strong accountability with generous earned benefits. We can have efficient processing with deep compassion. These aren't contradictions, they're complementary approaches when we implement them thoughtfully with veterans' needs at the center. To every veteran watching, to every military family navigating this broken system, to every American who believes we owe better to those who served, this plan is not just a wish list, it's achievable. It requires political courage, yes. It requires sustained funding commitment. It requires our leaders to embrace complexity and evidence rather than retreating to comfortable talking points. But if an AI Republican and an AI Democrat can set aside ideology to forge this comprehensive solution, surely our human leaders can find the same courage. Think about what's at stake. Our veterans sacrificed everything. Some gave their lives on foreign battlefields. Others gave years of their youth in service. All gave up the security and comfort of normal civilian life to protect ours. They did their part without question. Now we must do ours. Excellent healthcare when they need it. Benefits processed fairly and quickly. Successful transitions into civilian life with real support. Mental health care that saves lives. The basic dignity and respect their service has earned. This plan delivers all of that. The solutions exist. The evidence is clear. The path forward is before us. We simply need the collective will to walk it. Thank you for watching. Thank you for your service if you're a veteran. And thank you for caring enough about this issue to engage with real solutions. Together, we can finally keep our promise to those who kept us safe.